All right, here we go with another episode. Welcome to the Purpose Maker podcast, the Midlife Wisdom Podcast. This isn't just another self help podcast, it's a soul help podcast. It's a conversation, one that's been crafted from real people, real struggles, real victory, and real transformations. In these episodes, you'll find stories of people just like you who've discovered their greatest purpose, often emerged from their deepest challenges. Most importantly, you'll discover you have far more control over your story than you might believe. Your thoughts, your character, your circumstances. They're not just happening to you, they're waiting for you to step into the role of purpose maker. So let's begin. Not with the grand promise or 10-step plans, no constant self reflection or endless journaling, no personality test, vision boards, or finding your authentic self. We're going to start with a simple truth. Your purpose is already within you. Sometimes it just needs a little wings getting going. And since life's deepest meanings are discovered through authentic conversation, I invite you into the sacred dialogue about your life. Not as an expert with all the answers, but as a fellow traveler who's learned that our greatest purpose often emerges from our deepest struggles and conversations. So today I'm going to introduce you my guest, Dr. Brandon White. Brandon is a wonderful friend of mine, and I'm just going to go over his bio a little bit here, introduce him, and then we're going to have a fabulous conversation about life, health, purpose, and what we've been up to. Dr. Brandon White goes by Dr. B. He's a second generation chiropractor, graduating from the prestigious Palmer College of Chiropractic, also known as the Fountainhead. This is where he was involved in various professional education groups and represented the college as a former Division I rugby player, competing in the national finals in 2001. In private practice, Dr. White has dedicated thousands of hours to postgraduate studies, refining his expertise in chiropractic, functional medicine, brain injury, and human performance. He regularly speaks on health topics and a regular podcast guest. His most recent work centers on brain health and injury rehabilitation. As a certified concussion specialist, he's attended the premier North American Brain Summit at the University of Colorado. Dr. White has worked extensively with brain injuries, neurodegenerative diseases as well. Using functional EEG technology in office, he has documented remarkable improvements in patient brain function across multiple parameters. His integrated approach combines chiropractic, functional medicine, cold laser therapy, mindfulness, and stress management to help his patients achieve optimal health. Dr. White, welcome.
Thanks, Doc. I really appreciate you having me on the show. I'm really excited to join you, and this has been years in the making.
This is going to be fun. So as we jump into some of these things, you've got a pretty powerful story that very few people listening know. I was close to it, but I don't know all the details. So it's going to be interesting to hear this. We graduate school, and so one of the cool things is you and I are roommates. So it was an absolute riot going to school. We graduate, we both end up in practice, and then give me the history. What happened with the health challenge?
Well, it was about 9 months in practice. Things were going really, really well, and started to feel a little bit drained. But obviously, I was running a million miles an hour. Practice was exploding. I was on fire and just forging forward. And first thing I guess I saw was some significant fatigue, which is very unusual for me. I was in fantastic shape. I was still playing a little bit of rugby, working out regularly, and long story short, because I had an angel in my life at that time, got bad enough that there's some signs that as a trained professional and a doctor, I probably should have recognized the signs, but I'm also a guy, so I call it dude brain. So dude brain kicked in and said, it's nothing. I'm just tired. I should be.
It's no big deal.
Yeah, exactly. It's normal. So having said that, fast forward a couple of weeks, that guardian angel in my life finally talked me into going to see a doctor. And fast forward to a diagnosis of acute lymphocytic leukemia with a thing called Philadelphia chromosome positive. So,
Wow.
Yeah, so briefly, I mean, obviously that was a shock. I had never had any type of illness. I mean, more than maybe the flu from time to time.
But
And so of course now I'm facing my own mortality. And it was
okay, so how old were you when that happened?
okay. So it was actually 5 days before my 30th birthday. So yeah, so I vividly remember that. And the unique thing about it with the type of the diagnosis that I had was it was super unusual for somebody my age to have gotten that type of leukemia. And I remember the doctors telling me originally that they were kind of confused by it because it was a type of leukemia you'd normally see in a young child, and it's almost always fatal. So
Jeez.
yeah, so here I am facing a probably don't have much of a chance of living no matter what you do. So I had decisions to make. So
Okay, so how was that diagnosed? Was that a blood test? What happened?
yeah, I'll spare you some of the gory details because I let it go pretty far. But yeah, there was some blood tests. There was actually a rectal exam that was involved in that. It was kind of the main constituents because I was bleeding.
Mm,
Um, but those were the main things. And ultimately, what they did was a bone marrow biopsy. For anybody that's had one of those are a joy.
was that in the hip?
Yeah, it was in the back of my hip, just next to my sacroiliac joint. And they drill through the bone, take a core sample of your bone marrow, and by analyzing that, they're able to tell whether you have leukemia, things like that. Because it is a blood disease born in your bone marrow. And so that's how they diagnose it and track it along the way. So I got to endure, I don't know, 5 or 6 of those. So shows you how tough you are, I guess.
Do 5 or 6 bone marrow?
Biopsies. Yeah, they wanted to do more, but I mean, I have my limitations. I was finding as like I'm done with these.
Yeah, I don't need any more of that poking.
Yeah.
I do remember hearing that you might have had one of the worst prognoses on the floor because I remember coming down and seeing you.
hmm
Did you get transferred downstate? What happened with that?
Yeah. So the way things have played out is actually, I was originally misdiagnosed, and they were going to treat me at Munson Medical Center right in Traverse City. Um, they started chemo, and about a day or two into it, they came in and they said, "Oh, we misdiagnosed you. Mayo Lab says you have ultimately that diagnosis I shared with you originally." And that changes everything. So, if, and I mean if, we can get you into remission, then what's going to happen is you're absolutely going to have a bone marrow transplant, or you're going to have really no chance of living through this because statistically you're going to relapse, and we got nothing for you. So I ended up going down to Detroit some months later to the Barbara Carmanos Cancer Institute and had a bone marrow transplant down there. I think what you're referring to as far as like the worst chances on the floor, a scenario played out right away. Anybody that knows me won't have any trouble believing this. But when I went in for my pre-op and pre-procedure, I guess, they were kind of giving me the lowdown and everything. And I told the team of specialists, I said, there's something you need to understand about me. I'm not a sugar-coated type of guy. Give it to me straight up. And if you think I'm going to die, then you tell me. And so doctor goes, okay, I can respect that. And I said, all right, doc, what are my chances, you think? And he said, well, I don't remember the exact number, but he said something along the line. There's about 30 people on the floor that will be getting transplants at the same time that you are. And you have the least likely chance of making it.
Jeez.
Yeah. Now I can back this up.
That's gonna be chill.
It does me too. It took
Yeah.
a long time before I could even talk about this.
Yeah.
So, but this sets the stage for everything that you and I are going to talk about today. And I think it goes back to that soul because there's something in my soul that came out at that very moment. And I think it's just who I am. So as soon as that doctor told me that, I looked him straight in the eye and I said, you know what? That's good news. And he looked at me so puzzled and he goes, are you in the wrong place? Do you want to die? And I said, no, 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 no. You're looking at this the wrong way. The reason I say that is because I'm not going to die. So that means nobody's going to die.
Oh, that's awesome.
Yeah. So, and sad reality is, as far as I know, only 2 of us did make it. So, and I can't, yeah, made it. Yeah. So I can't say that, I guess the odds were a little stacked against me at that point. But, at that time it was all business.
So when you say a bone marrow surgery, what is bone marrow replacement?
So it's not as brutal as some people think, honestly. So the part that's rough about a bone marrow transplant itself is the prep to get you to it. So everybody's heard of Bubble Boy, right? That was me for a little bit. So for about 2 to 3 weeks, the program was, once again, remember, no sugarcoating anything. So the program was every day we're going to give you a near lethal dose of chemotherapy. And if you live, we're going to give you another one the next day until we cannot detect one white blood
So you're
cell.
trying to get it into remission.
Yeah, well, what they were trying to do essentially is a bone marrow transplant is essentially a immune system transplant. So they wanted to knock every circulating white blood cell out of the equation that they could find in the most sensitive tests. Once they did that, and that's why I was quarantined, once they did that, then they take the stem cells from a donor and it's actually the process itself is only a blood transfusion. It takes a couple hours. But and then the next, I think it was like 15 days was the critical time, which is called engraftment, and that's when you see if you rejected the transplant or not. So
Well, we know the answer to that.
yeah, it's going so far so good. There's a really unique thing that happened sometime after that we'll end up sharing at some point, and it was the number one turning point that got me to where I am now at nearly 50 years old. I'm thriving, my man.
And I love it. I love it. That plays right into what I've been talking about with the purpose maker and the tip method. And transition, identity, purpose are the three core things nestled inside of our life that we have to wrestle with. And obviously, your transmission, or excuse me, your transition was unplanned. Like you're just rocking, thinking about life, getting busy, doing stuff, and you've got to now deal with this major issue. How did it affect your identity?
Oh man, how did it? So my own personal identity, I think it showed me what I was made of, and it showed me more than anything what my purpose is moving forward. So everything that happened in even being told that I definitely was going to die at one point through the entire thing, it gave me purpose, and then that purpose created my identity to say that here's what I am, here's who I am, and here's what I'm going to do to.
Here's why I do it.
Yeah, and here's why I do it. I mean, why did I do it? I wanted to live. Really interesting thing that people are saying, oh, you're so amazing. And I think if you talk to anybody that's been through what I am, I appreciate people saying that, but it's not amazing. I had no choice.
Right.
So maybe in hindsight, it's always been 2020. Maybe I was amazing in the choices that I made, but I was in the same situation that anybody else is, and it was choices. And so the choices I made ended up being really good ones. That's why I do what I do now.
You made some good choices. Tell me some headbutting that happened with the doctors on recovery. Did you run into a lot of differences in philosophy on how to rebuild your health?
Yeah, without a doubt. So this won't surprise you. I have a lot of people that come to me at different stages of cancer diagnoses, and what do I do? And it's anything from I refuse to do chemo, I want to do what you did, to I'm going to do chemo, but I'm concerned about ever regaining any quality of life afterwards. What do I do?
Sure.
And it's a long interview process with people, but it's like, do you have what it takes and what you really, really want? So one of the things that I discovered was, and a little bit of background here, before chemotherapy, I had never had a prescription or over-the-counter drug in my body in my life.
That's 30 years old.
Yeah, 20, yeah, almost 30 years old. So I'm talking, I was never vaccinated. I never took an aspirin. I never had a cough drop, things of that nature. And it was the way that I was raised. So going into this, I had this idea at the time, now I know it's the truth, that our bodies uninterfered with can do a better job than any human intervention. So what ended up happening was after my bone marrow transplant, understand I was 215 pounds and 7% body fat going into this whole thing. I came out of my first round of chemo at Muncie Medical Center at 135 pounds. Yeah, of course, lost all my hair, which never came back for some weird reason. You remember my boob fine? Beautiful. Yeah, no, you don't. Never have. So anyway, coming out of that, I was in a really bad place. And of course, with chemotherapy, modern drugs and medicine were essential. And I never thought I would say this, but they're amazing. And they do work really well when they're used properly. So the conversation that came about was, okay, You had engraftment, which means a successful bone marrow transplant. I did have a fair amount of what's called graft versus host disease. So it'd be similar to if you got a kidney transplant, your body rejected a kidney. Well, since I got um, a bone marrow transplant, it was like my immune system can reject anything.
So did you have to be on anti-rejection meds for a little bit?
So anti-rejection, antiviral, antibiotic. I mean, there was 10 to 15 different medications that I was supposed to take for the rest of my life. So we fast forward to the day that I was to be released from the Carmanos Cancer Center. They were sending me home, and I vividly remember the lead doctor on my team.
How long was that? How long were you there?
Yeah, how long was I in Detroit?
Yep.
Including inpatient and outpatient, 3.5 months. Yeah. So yeah, it was a long time. And so and of course, you know what beautiful northern Michigan is like. So I felt like I was in jail.
Right.
I never
felt down like seeing
yeah,
you.
exactly. You were one of the few people that saw me because I don't want to see anybody. But
And now I'd come down and see you.
oh, of course. Yeah. So sitting down, doctor shoves all these medications across the table, congratulates me on the outcome, and says, "Here's the drugs you need to take for the rest of your life." And that wasn't the conversation that I went down there to have with him. The conversation that I was going to have is, okay, thank you for what you did with me. I'm done with these medications. Get me off of them.
Mhm.
And when I said, get me off of them, he looked at me and verbatim, I will say, he said, I will not do that because if I do, you will die in short time and I'm not going to have that blood on my hands.
Hmm.
And so, disclaimer, do not do this. At that very moment, in front of that doctor, I threw every one of those medications in the garbage and said, I'm going to figure out a better way. You're never going to see me again.
Mm.
So this is relevant to the conversation. So I'm going to throw it in there because this gave me the motivation to do what transpired after that. As I walked out the door, that doctor yelled to me, "You're right. I won't see you again because you'll be dead."
Ooh.
Yeah. So fuel for the fire. Now I'm sitting here, in case everyone doesn't know, a little interlude here. I'm sitting here with a man. If you ever want to get something done, tell him he can't do it.
I don't think a lot of people know that about me.
Oh, it's true. It's true.
Yeah.
So having said that, I'm not going to tell you it was all strawberry fields. I hit some really, really difficult times. I had a lot of that graft versus host disease. And retrospectively, when I look at things to get to the level of health I am right now, it's been 20 years. It took 20 years.
Wow.
So, because health is a lifelong journey.
Sure.
And it's so much easier to be unhealthy than it is to be healthy. But
That is a true statement.
it is so worth it to be healthy. So,
Mm-hmm.
so I left there, never took another medication again. And like I said, I hit some dark times, but some very, very key people came into my life at that point and showed me some options that were out there.
Interesting.
Yeah. So things came together at a very pivotal time where there was a lot of technology in the world of nutrition, especially supplementation.
Mm-hmm.
And there was a whole class of supplements born that are called Nutraceuticals. So they're not you cannot buy these at a grocery store. And that's why maybe people wonder, well, how come the doctor can get that, but I can't? They're medicine, folks. They
Right.
work like medicines if you know how to use them.
Yeah, they have stuff in them that you can't sell over the counter.
Exactly. So there's a lot less risk because usually they don't kill people.
Yep.
Having said that, there's certainly some things that you need to know. And the biggest thing is there's contraindications with other drugs.
Sure.
And so you have to be careful with that because I'm not so naive to think that everybody's in the same headspace that I am because they're not.
They're not.
So,
No.
but people are getting there. So,
So what were some of the steps you took to start rebuilding your health?
so one of the first things I did was because I couldn't work. Interlude here. I actually became a professional truck driver for a minute. That's one thing I could do.
That is amazing. I did not know that.
Yeah, so I went and got a Class A commercial truck driver's license, and I drove cross country for a little bit. Actually, absolutely hated it, but a good friend of mine gave me the job, and I was willing to do it.
Sure.
So, but what I started doing then was listening to a lot of recordings, and I'm old enough, it was before podcasts, but a lot of recordings and things of that nature on nutrition and health. One of the fallacies, I guess, that people have about you and I is that we have some deep foundation from our education in nutrition, and we don't.
No,
So,
you got to learn it.
so we have an incredible foundation. Chiropractic is the best springboard out there for functional medicine. But
100%.
but it took thousands and thousands of extra hours to learn how to use and apply it.
Yep.
15 different names for every herb and things of that nature, which I don't know all of them. But so as I learned a little bit more and a little bit more, I have to say I was probably just about like everyone else. I truly started with, well, this sounds good, but how in the hell is a vitamin going to help me get better? How naive I was at the time. But when the parallel was drawn that simply enough, if I don't eat, I die, and nutraceuticals are food. Okay, so we can compound food and then we can make it medicine for us. That starts to resonate with me. Then when I started learning about herbs, which I had an herbalist working for me, and one of the things I can't handle in my office, even though it never goes this way, nobody can know more than me. Well, unfortunately, everyone does, but I work on it every day. But so this herbalist pushed me out of my comfort zone to become more familiar with herbs, and that really blew things wide open. So, but over time, what I was able to realize was that there's some very key things that happen to people when they go through chemotherapy. Now, a very, very important distinction to understand the difference that you'll see between, and the philosophical difference between medicine, using medicine to try and create health and using nutraceuticals, is the idea of your immune system. Now, everybody on this earth knows how important your immune system is. However, for almost every drug out there, your immune system is a problem. So, meaning if you have a strong immune system, the drugs don't work as effectively.
Yeah, mitigates it.
It's actually, so that's why they had to knock my immune system out to be able to do what they did. Antibiotics, one of the biggest offenders of that
Immune system.
Yeah, of knocking out your immune system, because we'll get into this sometime because it's a hot topic, but the gut-brain connection,
Sure.
via vagus nerve. But what I realized was my gut was destroyed, and so my bathroom patterns, if you will, were changed significantly, and I started to understand how an inflamed, unhealthy gut creates an inflamed, unhealthy brain. And everybody that's ever had chemo has heard of chemo brain.
Sure.
There you have it.
Well, here's one understanding that I've come to learn. Tell me if this is something you've learned. I heard chemotherapy kills fast acting or fast dividing cells. And so there's 3 fast dividing cells in the body: hair follicle, intestinal lining, and cancer. And that's what it wipes out.
Mm-hmm.
This is why people lose their hair. It's why the digestive system's are wrecked. And obviously, at some capacity, you can get some of the cancer knocked down.
Yeah, no, absolutely. And, like I said, that technology, it does work in a lot of cases. The problem is it weakens a person to the point at which most people that die from cancer actually don't die from the cancer. They're treated. Yeah, it's usually pneumonia.
Yeah.
So if you can't fight it off, yeah, absolutely, that could be deadly. That's what killed a lot of people during COVID.
Yeah, and pneumonia is big right now.
Oh yeah, the walking pneumonia, that's a real thing.
Yeah. Yeah, I've had a lot of patients that have been sick.
Yeah.
Yeah. That COVID thing was a crazy couple years.
Oh man. Yeah, boy, what I learned during that time.
Mm-hmm.
So, but biggest value I took away from that is people are now extremely interested in taking over some personal responsibility for their own health, and they're looking for answers.
Yeah, there's definitely been a change in the market and the way people are looking at those things.
Yeah.
I've seen that quite a bit.
Yeah, so there's a lot of new stuff out there, and my calling, what's driven me is to learn about it, not just what it's called, but what's in it, how it acts upon the cells in our body, its actual mechanisms, and why it creates health. Because I'm not a do as I say, not as I do. Do as I do because I do it, and here's why I do it. Mm-hmm. And that's a key factor. I think any doctor needs to be able to communicate, and that's what a lot are lacking.
That's right. All right. Well, do you have anything, any supplement that you brought? Do they pertain to what this conversation?
Oh, absolutely.
Let's go.
So first of all, to set the stage for this, because it was so long ago, it wasn't exactly the golden age of nutraceuticals. It was kind of the beginning of it. So throughout my travels in learning how to rebuild my system, I have forged deep friendships with some of the brightest minds in the world, in the world of nutraceuticals, whether it's the people that are applying them or the people that are actually making them.
Sure.
So why do I tell you that? Because they're just flat out better now than they used to be. So now, obviously, one of the biggest things that I did right away was fix my gut. Get busy fixing my gut. And that's a lifelong thing because anytime you get a gut bug, you got to start over to some degree. So one of the things we found here, this first item, Physica Energetics is a small company. They're founded out of Canada, but they also have their US base in the Pacific Northwest. Fantastic family run company with some of the brightest people in this industry. The glutamine complex, one of the things that we find with people that have digestive problems is absorptive issues, of course.
Sure.
And so, what's the sense in taking supplements you can't absorb? So, there's that old, well, I just pee those supplements out. Well, you do some of them for sure. So, you get into the world of these guys are very deep into delivery systems. What can we couple with this that's going to help your body absorb it better?
Delicate chelation.
Yes, yeah. So, I know that you got like that activated magnesium that you promote. That's the best on the market.
Sure.
So, so yeah, they'll use that. There's a thing called liposomals. Liposomals are absolutely amazing.
And I still have patients take a picture of it and go try to buy it on Amazon.
Oh, of course it is. Oh, so yeah, actually, real quick on that, because this has been proven over and over again. I just heard a statistic that possibly 60 to 70% of the quote unquote, standard process, all the nutraceuticals out there that you find on Amazon are repackaged with not that supplement.
That's not good.
Yeah. So you can find the research out there. But so I use this one's a powder that I use a bunch of most of the time because powders, you put them in liquid, they absorb better. It's easier. A lot of people have trouble swallowing stuff.
Sure.
Even now. So how many people out there, and this will resonate with you, are having trouble swallowing things? Isn't that weird? So I'm seeing a major uptick of it. And, we're thinking current thinking has to do with the massive amount of inflammation that are in people because this COVID thing is still here.
Oh yeah, there's still COVID virus in almost anybody that's
Well, it's absolutely. I mean, we know from thousands of years of studies that viruses, current thinking and has always been the thinking is that we don't kill them. They don't go away. You upregulate your immune system, downregulate their function, and you can live with them. It's a symbiotic relationship as long as it doesn't get out of balance.
sure. And they mostly live in the nerve system.
Yeah, yeah. But they can travel
Yeah,
everywhere.
organs. Yeah.
Yeah, they can travel everywhere. So the main thing that's going on with people right now that I'm seeing in my practice is it's not so much COVID itself, this long COVID thing. Really, what it's looking like long COVID is all the stuff that you've had in your whole life. Everyone's had chicken pox, so they've got varicella in them.
Sure.
And so that manifests itself as shingles. Anybody notice how in the last few years, everybody's got shingles, even younger people? So the immune suppression that happened with all the different facets of COVID now has caused people to be so immune compromised that now they're in a situation where anything's manifesting itself.
So the craziest story I had with a patient over COVID is she had a bad reaction to COVID. She had something called parosmia.
Mhm.
Parosmia. She was adverse to meat. She could no longer stomach or even smell meat without having a visceral effect. And that lasted like, I want to say like 18 months, maybe 2 years before she was able to have meat again. So that was wild to me. The virus would get in so much that she couldn't even stand the smell of cooked meat.
That's funny you bring that up because I've had a couple of those. I think they're few and far between. And so anytime something like that happens, something that's weird, especially when the medical doctor's like, I don't know, take this. I look at why could this be? So this is certainly not saying, hey, this is why that happened, but we know that COVID attacked the breathing centers in your brainstem. In fact, one of the anecdotes, strangely enough, was nicotine. Nicotine bound to those sites and blocked the action of COVID, and people were having those respiratory issues.
Right.
So a lot of people, of course, also know that your senses of sight or a taste and things of that nature, they're all tied together. So people lost their taste too. So like I said, those are tied together. So we're looking at this aversion to meat. Smell is part of that sense system too. So to me, that's all tied together with a lot of these respiratory issues people were having. So it changed the way you perceive food.
Oh, this is kind of crazy. So it would have been January of 2020. So before COVID was nationwide or known.
Right. People
I,
existed.
I actually was down in Traverse City to see you,
Mhm.
and I had my arm in a sling. I was coughing so bad,
Yep. I remember.
and I guarantee that was a COVID infection
Oh, it could have been.
before we even knew what it was.
No, I think you're right. In fact, I know that before, I always say before COVID,
Yes,
existed.
pre and post COVID, man. Our brain does that.
Exactly. So no, I had it was in March, early March.
2020.
Yeah, I was going through a very stressful time. I was, actually were close by my side as my older brother died,
Mm.
and the stress of that and everything. And that day that he passed, of course, undiagnosed because I had no faith in those PCR tests. But I had the symptoms, and yeah, I mean, I took a dive. I think I got it. And so now I understand how important it is to deal with it.
Oh yeah, do
So,
immunity for
yeah,
sure.
yeah, no doubt.
Okay, so the supplement you just talked about,
hmm
does that have to do with leaky gut?
Oh, absolutely. So the interesting thing, and that's a good question.
Yeah.
The reason that I brought this today was because that is the base thing. So a lot of times people will be like, "Oh, I'm taking a probiotic." It's not like that. They're like, "Okay, well, when you're taking the probiotic, does it work?" But then you stop and it doesn't. And you're like, "Well, yeah, that's weird. I don't want to keep taking it." I said, "Well, here's the thing: you're putting the cart before the horse." So almost everybody's heard of leaky gut, and so, but they don't know really what it is. Now, throughout your digestive tract, you have a mucus lining, and it's an extremely important lining to have. Not only does it separate the inside from the outside, but it's essential because it's food, shelter, housing for your good gut bacteria. So,
And the mucus.
yeah,
Yep.
yeah, exactly. So when that breaks down due to an unhealthy environment, then your good gut bacteria is weakened, just like your immune system would be, and the bad stuff can really get a hold of it. So when you've heard of like SIBO and things like that, ulcerative colitis, IBS, those are all imbalances of gut flora. There's other things that go with that.
Inflammation.
Yeah, inflammation, exactly. So the inflammatory part of that is you've got digestive enzymes, raw food, things like that coming into contact with the epithelial lining or the skin lining of your intestines, and it inflames them.
I was going to say starts an immune response.
Exactly.
So inflammation.
Yeah, exactly. So that kicks off the entire out of control immune response, which we're going to talk about in a few minutes. So what does this do? It rebuilds that layer. So we know that glutamine is very, very important to not only feed the good gut bacteria, but to help to rebuild that mucus lining. If you don't do that first, you're just banging your head against the wall.
So what about the patient that's eating fast food, drinking soda all the time? Does that contribute to that?
It does. So sugar, processed things, chemicals, anything in our body that doesn't have a use as far as helping us live and create vitality has some net bad effect at some point. So some worse than others. Now, what I mean by that, if you drink battery acid, there's going to be an immediate reaction to that.
Sure.
If you eat something with aspartame in it, which is the same sweetener that's been out there forever, they just keep renaming it. That slowly kills off your gut bacteria. It's been shown to be neurotoxic, meaning kills neurons specifically in your brain. So when you do that stuff, some of it has an immediate action, some of it has long-term action, but it all has an adverse reaction.
So the word I've come across for that is called an allostatic load,
Mhm.
and it's actually the cumulative effect of substance or some type of treatment over time.
Yeah.
And eating like that has a cumulative effect, which makes it very difficult because patients will eat like that and not have an immediate response. So
Mhm.
they don't make the correlation that this is actually causing
Right.
my poor health. Yeah, I struggle with it. With patients I see that are tend to be more fit physically.
Mhm.
They do CrossFit, they do all this, and then you see them out and they're drinking a Diet Coke.
Yeah.
And I'm just like, I try to talk to these things, but sometimes people are so locked in that they're like, well, I'm avoiding sugar. Well,
Mhm.
it's a great idea. However, this still has a net cumulative effect.
Exactly. So, sugaraholics, I got a bunch of them in my practice. You need to understand that there's a mechanism there. So without getting too far into it, there's a lot of food scientists out there that are paid a lot of money to get you addicted on things.
Sure.
And so sugar, being a sugar addict is something that you can't control. So I mentioned a little bit ago about that gut brain connection. And the reason that's important in this context is when you have an imbalance of bad gut flora and it gets the upper hand, it craves that sugar. And because of that connection to your brain thinks you need sugar. So it's not easy to quit.
All right. So then you just constantly want sugar for breakfast,
Mhm.
lunch, and dinner.
Exactly. And so, at that too, it's highly, highly inflammatory. So now if you think
Sugar
about,
itself.
yeah,
Yeah.
and you think about, because it's processed, the sugar that we eat now is concentrated and it's in a form that our bodies were never designed to take in.
High fructose.
Yeah, exactly. And it's just, yeah, it's probably the single biggest problem that we have in our food supply.
I just saw the research on that the other day. High fructose causing cancer,
Mhm,
and the top three. It's just me trying to remember off the top of my head. Smoking was number one.
mhm,
Obesity was the number two. Excuse me. Was the number two cause
mhm.
of cancer. I was like, so that was real interesting to read that
Yeah.
because I work hard trying to get my patients conscious and thinking about their health more than just the back is fine.
Yeah.
It's challenging. I had a patient years ago. I knew she had some bad habits, and this is before I really understood um, human drive. So I said something to her about losing some weight, and she looked at me and she goes, "Can't you just be a regular chiropractor?"
She didn't know who she was talking to.
I was like, "What kind of comment is that?" But I wasn't very versed in people then. I was young in practice, so I thought by default everybody wanted to be healthy. Some people didn't know how. That ended up not being the case.
Yeah, not at all.
Couple, maybe 6 months, a year later, I saw her at the store and she had a diabetic pump on her hip.
Mhm.
And I'm like, so now you've got a completely preventable disease that you have to manage the rest of your life.
Mhm.
And I was offensive by saying something, by bringing it up.
Yeah.
It's interesting. So I've gotten much more savvy.
Yeah. Well, you just get better at reading people after you have encounter after encounter after encounter.
Yeah.
And I mean, you have very impressively built a following of people that are invested in their future and their health. And they see you as a source to learn more and more about doing that. Because, like I said, it's a lifelong challenge.
Oh, it's a lifelong learning too.
Yeah. Oh, without
Which
a
I love
doubt.
to do.
Yeah, I learn from every single patient, no
Yep.
matter whether they're combative, not, don't talk, they do talk. You get the little nuances and help you to understand who that person is. My first visit with a nutrition patient, especially, I'm almost like a therapist because I want to see who they are, what they are, where they are, and what I
I think
think they're made of.
struggling with mentally.
Yeah, absolutely. See what they're made of because somebody that comes to you with a gut issue may have some very, very deep seated emotional problems that may or may not be, need to be addressed.
Mm.
So it's looking at a person as a whole, which is what we do. Like maybe our profession is one of the few. Um, it opens up a can of worms, but if you understand how to interpret that roadmap, I really truly think that our health is unlimited and we have no idea where we can go with it.
Now, there's a lot that we don't understand.
Oh,
Yeah.
so while both
Yeah.
of you are both in the state of awareness that we know nothing, but
That's a good state.
yeah, it is a good
Yeah.
state because you want more. Because at that point, you either quit or you continue to learn, and that's not in our DNA.
No, yeah, learning's fascinating because I've often thought of all the knowledge that exists in this world
Mhm,
and how little of it actually comprehend.
mhm.
And it's just amazing to think, wow, I could just set my life around constantly learning. And I've been so blessed, and I've said this to my wife quite a bit. Chiropractic gives you a foundation that is unbelievable for understanding physiology.
Oh, absolutely.
And um, now, 20 years into practice, I attract a lot of very interesting people
Mhm.
that are like you said, they're looking for more than just, oh, my back hurts, which it happens.
Sure.
The main thing is teaching people how to use this body, how to heal, how to function.
Yeah.
Definitely the main purpose.
Yeah. I think as you go deeper into practice, as long as you do challenge yourself, you become that person for your patients.
For sure. Yeah. And so this podcast is an extension of this office as we grow and touch more people and start realizing that this influence can be much larger. I had my first patient from California, never put my hands on him, found my stuff online, called in. We had a face to face on Zoom, went over some stuff, and I gave him a whole bunch of guidance.
Mhm.
So it's neat how the online stuff can be leveraged, and then leveraging your knowledge, getting good people in here to talk.
Mhm.
So, all right. So as we're moving through the brain gut barrier and the connection, the vagus nerve. Remind me, is that cranial nerve 10?
It is.
All right, that's what I was thinking.
Yeah, it is.
So tell me that connection.
So it's a unique nerve. You have 12 cranial nerves that all come out of your brainstem, and only two of them actually leave what's called the cranial vault or your brain itself. So one of them goes to your diaphragm, kind of important, and the other one is connected directly to your gut. So for a long, long time, they were trying to figure out what the heck is that thing for, and why would it be connected to your gut? Some of the recent research has suggested that, contrary to what we thought, was that your gut may have more control over your brain than your brain does your gut.
Oh, interesting.
That's pretty profound.
Yeah,
So then you go backwards in there. We're talking about restoring your gut. That's pretty important. So very seldom am I doing any brain work with anybody without at least looking at the gut first and making sure that we're in a good starting position.
sure.
So, but it's kind of it's looking being looked at as the nerve that is that is most closely connects our body and our being to our brain.
Okay.
So
And so that feedback is basically telling the brain how the gut's functioning.
mhm,
So if you're having leaky gut issues, which my understanding leaky gut is that the mucus lining
mhm,
is not very tight.
mhm,
So what you do is you get little pieces of undigested particles into the bloodstream,
mhm.
and then that starts the immune response. And now you can have systemic inflammation because you have too much getting through. That the leaky part of it.
Yeah. So I mean, it may be just what they call like interstitial fluid, things of that nature. But I think that even a more simplified way of looking at it is that mucous membrane is supposed to be a somewhat impenetrable membrane. So stuff's not really supposed to go through it other than like select nutrients.
Yeah, unless we absorb it,
Exactly.
the body needs it.
So we've got receptors within that and within the linings of our digestive tract to take those things on. So I think a good analogy to look at is if the gates only open a couple of inches, only so many things can fit through. If it's open a couple of feet, more
Anyway.
things can get through.
Sure.
So the biggest thing I think with that is just the mass unchecked inflammatory reaction that is caused by that. And inflammation is a player in every single disease out there.
Sure.
So,
Well, and it causes all the joint and spine pain that people come in and complain about.
oh, it does for
That's
sure.
definitely the base of that.
Yeah, there's no question. And, I guess no better time to segue into that when we're talking about, the nutritional aspect of inflammation and whatnot. There's nutrition that you can do that. I mean, probably everybody at one time or another has heard of that simple spice called turmeric. Okay. But how many of your patients have told you, well, I tried turmeric and it didn't work for me? And you're like, well, that doesn't surprise me. What'd you take? Well, I ate it every day. So here's the uniqueness about the turmeric itself is when you eat turmeric dietarily, your body, your liver, makes an enzyme that deactivates up to 80% of what's called the curcuminoids. Those are the natural inflammatory modulators within turmeric. That enzyme activates up to or deactivates up to 80% of them. So the take home is anybody that's eaten too much turmeric knows comes out like a fire hose on the other end.
Mm.
So to be able to get a therapeutic dose to actually modulate inflammation, you have to eat more than you actually could. So then came to, well, how do we make it work? So they started concentrating and encapsulating it, and they were having same problems with gut irritation, things of that nature. Then some really smart people came out and found out that if you couple it with an enzyme from the fenugreek seed, it's called galactomannoside. What it does is that galactomannoside sacrifices itself to that enzyme that your liver makes, and now it frees up the curcuminoids, and because they're concentrated in that formulation, you're getting up to 80 times more bioavailability, usable curcuminoids circulating in the system. So,
Interesting.
yeah, so I've got a really incredible story about the turmeric that we can share whenever it's appropriate.
Hit it. Love to hear it.
All right, so this is super appropriate. So today is the 13th.
Okay.
So in 5 days from right now, 1 year, it'll be 1 year since I wiped out on my dirt bike. Yes, I was riding my dirt bike in the middle of the winter, and I was pile drived into the ground. I blew my left collarbone into 10 pieces, and I got a concussion to where I split my helmet.
I remember that picture you sent me.
Oh yeah, I was not happy. So having said that, of course, I'm laying on the ground, and after I regained consciousness, of course, the first thing that came to my head is, "Oh no, this could be it." So we of course worried about our hands, our arms, things of that nature. So fast forward to a friend of mine had introduced me to cold laser therapy, and just like everything else I put into my practice, I was a naysayer. And I said it's garbage, it's voodoo, all this other stuff. Now I use tons of voodoo.
Yeah.
And so I went in because and this is how she framed it to me. You have nothing else going on. You're not working. So I went into her office. I had some cold laser therapy. I used high doses of turmeric. What we know is the 12 capsules of the turmeric that I use, which is this, it's actually called from the Gaia Pro line. The specific type of turmeric is called Kirchhoff-Fen. So, and it's very important. Only a couple of companies even have it. But I was taking mass tissue saturation of that, an herb called gold cola, which helps with tissue perfusion of blood to the tissue, and I was doing laser. And I can document this.
You're talking directly
Laser right on the wound, pre and post surgical. So I can document what I'm about to say right here because I've got it on video. 13 days after I had an emergency surgery, had a plate and 10 screws put in my collarbone, I was back in clinical practice, full practice, working with zero pain. 13 days, right? So
amazing.
One example of how this stuff works. So you may have picked up that I keep saying inflammatory modulator. I'm very careful not to say anti-inflammatory, though I slip sometimes. People have been led to believe that turning off inflammation is a good thing, and that's what NSAIDs do.
Sure.
Inflammation is paramount for healing, but because it can get out of control from some of the things we just talked about before, when it does, you don't heal. So they shut it off with an NSAID, and then it comes back fiercely, and then you have to take another one.
Yeah, so you're constantly in that cycle.
Exactly. And so when you can modulate it and keep it smooth like it's supposed to be, I'm living proof, and many of my patients are, that you can have a way better outcome. So, I mean, at 49 years old, 13 days with a major injury, I'm back in clinical practice.
Yeah, that's great.
So, yeah, so, that was one of the things that I used for that. Now there, another thing that we talk about all the time that is paramount in any kind of a crisis that happens with a person is stress. You ever stressed out?
Oh, geez, man. Midlife.
Yeah, exactly.
That's it.
So, some of the stresses in our life are the tremendous amount of pressure we put on ourselves to not only educate, but figure out how to communicate with people the value that we can add to their life. And so, when that comes to kind of some herbal formulas, this MediHerb, which is a company out of Australia, this was formulated by a man that I know quite well now. I've gotten to met him a couple of times, Professor Lee Carroll. He was one of the founders and main formulators for MediHerb. Naviton Forte, there's a class of herbs out there that help to calm. They're called calming nervines. There's 4 different ones in there. And what they do is help to calm your system. Now, a lot of times people are just running a million miles an hour. Some people have even maybe heard of sympathetic overdrive. That's when your foot's on the gas and you just can't shut your brain off. So lots of people in sympathetic, they get locked into that. Oh, they'll tell me I lay down and I'm so tired, but my brain will not shut off.
Does that also lead to like the what is it when people shake their feet when they're trying to lay down?
Oh, restless leg.
Yeah.
Yeah, I'm sure there's a connection there. Although there's still a lot unknown by restless nerve.
So one thing I did come across on the restless leg syndrome was the nerves being inflamed or affected by viruses.
Mm-hmm. Yeah.
Right.
Yeah. So there's viruses affect a lot of our nerve function. Without a question. So in fact, anybody that's ever heard of Guillain-Barré syndrome, that's a virus-borne long-term issue that causes some significant neurological
Oh
problems.
yeah, people can't walk for days.
Yeah,
Yeah,
and it's scary because it really looks like you're declining rapidly.
yeah, yeah. No function.
And there's ways to deal with that. Now, coming full circle, a lot of the therapy for that is, in the world of pharmaceutical antivirals, they don't work very well. COVID. And so then they do antibiotics, which are contraindicated for viruses, and then that just weakens you even more and gives it the upper hand. So,
Sure.
I guess this is a good time to say I truly do not believe in almost every situation your doctor has any malice toward you in recommending these things. It's just what they have. So I always talk to my patients about what's in your playbook.
Mm,
So, and you don't bring baseball plays to a football game. So, we're in a situation here where I think we just have a better playbook for that type of stuff.
right.
So that Naviton, and I talk to people, it's the calm the bleep down. And so a lot of times people running a million miles an hour helps them to get more level headed. So people say, well, I've tried antidepressants. Is it like those? Because I didn't like them. And I said, well, not really, but kind of. So first of all, they're not habit forming. That's kind of big.
Sure. That's probably not serotonin reuptake inhibitors.
They're not. They actually help you use your neurotransmitters more readily and more, properly. And a lot of that has to do with brain inflammation, going back to the gut.
Sure.
So, by having said that, basically what it does, everything's okay. So if you're a person like, oh my God, I got so much to do, you're walking in circles, you're not getting anything done ever. This just helps you be like, okay, got this, and this. Let's get it done. I got
Get a little
this.
more focused.
And I got this is a huge leap for a lot of people.
Yeah, it's a good
So
feeling.
that's one of my best sellers. I almost everything nutraceutically that I do involves echinacea. Everybody's heard of echinacea. It's been studied for years and years and years, and we know that there's more effective forms. And the most effective form is going to have both forms of the echinacea, which is the angustifolia and the purpurate. And if it doesn't have that, it won't work. So you do a little pearl here for all those people taking their echinacea.
Yep, listen up.
If you suck on your echinacea and it doesn't make your tongue tingle, throw it out. It's junk. So the alkalamides that are found within the echinacea plant are what make your tongue tingle. The more you tingle, the more potent it is.
Sure, that's a good little point. That's easy to remember.
It's easy to remember. So I mean, yeah, if my big thing is with people too buying supplements, because it's like anything else out there. There's junk and there's really good stuff, and then there's people that have the good stuff that have no idea how to use it. So finding that right individual that understands that is fairly unique, but it's important. So if you, I hear a lot of times, oh, those are so expensive, and I said, go with me. You're not going to be telling me that in a little bit because it's going to be worth it.
But yes, if you see the changes in your health.
Yeah, if you feel better. So when it's not worth it is when you keep doing the same thing over and over again and nothing gets better.
Sure.
So I don't let that happen. So I know that I've talked to you pretty extensively, and I know that any labs that you look at, and just be from living in this northern climate, vitamin D is a huge thing. Vitamin D was huge during COVID, and it should be. What we're finding out now is the reference range for vitamin D is you should be at the higher end of that, if not above it, because now they're figuring out it's one of the most important things for inflammatory modulation and anti viral action.
It's vitamin D.
Yeah. So, you look at like this is a liquid. I like liquids. And the reason I like this one is it's also got the K2 in it, and it's a D3, which is highly absorbable.
Sure.
So those two things make it so, and because it's a spray, you absorb it, you spray it under your tongue, you suck it and let it sit in there for a while. It absorbs through your mucous membranes, and then shows all the research shows us that you get a much better, higher dose. Right. So liquids with D3 and K2 are amazing. And a lot of people, once again, they don't like to swallow stuff. So liquids are where it's at. I didn't bring any with me today because I could go for hours on it, but there's another technology that I use a lot that's called liposomals. I know we talked about that recently. Liposomals are probably the most amazing thing in the world of nutraceuticals because what they figured out is how to bypass bad digestion and still have uptake.
Yeah, that's good.
Nutrients. So you got a bad gut, you take those and they're absorbed through your mucous membranes before they hit your gut. So
well, I think where you see this the most in patients is they're taking calcium supplements and they still have bone health issues.
Oh, for sure. Yeah.
So
Yeah. That's a whole other topic too, because that's
yeah,
being treated so wrong.
it's definitely an interesting topic, which
Yeah.
we'll do that on another podcast.
No, I do want to do that because we need to talk more about
Yeah.
how vitamin D can actually leach calcium out of your bones if you're not taking it properly and stuff like that. So all of these things have nuances. That's why a lot of people come to me because I put the time into learning, how
Yeah, to
how they all
understand
work
how they
together.
function.
So,
Yeah.
but I mean, what I have found here is that these things with people's agreement are able to vastly improve their situations for a lot of different things.
Yeah.
It's humbling the things that I see people for. And it was funny you brought up California a few minutes ago. I never ever thought I'd be in the situation. I had people, a guy and his daughter fly in from California just to see me yesterday. And that
Mhm.
is so humbling to me. But it lets me know that the work I'm doing isn't going unnoticed either.
Sure. Yeah, people
So,
start doing. I want to hear a little bit about brain health,
mhm,
and this one's particularly important to me. Because a couple of years ago, our daughter got in a very bad horse accident,
mhm,
had a concussion, and we actually came down and saw you. We had a EEG scan,
yep,
which is an
so,
electroencephalograph. Yep,
something, yeah,
encephalogram, and basically we documented a baseline, which where her brain function was.
mhm,
You did a bunch of testing. You got us on a supplement regimen, and then we came back and tested to show improvements.
yeah.
So tell me how that technology has also helped Minnesota stuff.
Yeah, so there's a couple of different reasons that I got into this functional EEG world. First of all, one of my mentors and a very well-known guy in the world of functional medicine, who I give 100% credit for where I'm at right now, Dr. Davis Brockenshire, an amazing mind in this world. He introduced me to this Wabi brain scan, this EEG technology. And the reason I believe it's superior to the other ones out there is because it's not looking at what your brain's doing when you're sleeping or resting. It's looking at how well your brain is functioning when it's challenged. So we do auditory, visual, motor, tie them all together. We do look at your brain at rest and we look at your brain at work.
Mhm.
Now, in Hope's situation, we didn't have a baseline, which would be ideal to see. Here's Hope healthy.
Previous, yeah,
Yeah.
prior to the injury.
But what we could show was we understand because of the data that we get that is how quickly your brain is processing, how quickly you're recognizing and reacting to a stimulus, and where your brain's calculating things. So we know there's an area called parietal zenith where it's kind of where everything comes together and you decide whether you heard or saw a stimulus and then you react to it. What I see a lot of times is people have very little activity there, but it's all up front. And I don't recall for sure where Hope's was, although I know we could
Thought
see
remember on the side.
yeah, we
Yeah.
did see the injury on it. She had
Yeah.
very low voltage in it, which
Yep.
shows a brain injury.
Yeah.
So we see a lot of people that have just frontal activity, and it ties so closely to their history, change in attitude, motivation. So the areas that control who you are, what you are, and how you interact with people, your mood, how people perceive you.
Is in the front.
Yeah, that's all
Yep.
frontal. So interestingly enough, and this is kind of an aside, but that's why they started doing lobotomies. Do you know the history of lobotomies?
No, but I
Oh,
know they would cut the what?
frontal lobe.
Right. Or cut the frontal lobe right off from the brain.
Yeah, so
Yeah.
you got to hear this because this is actually really entertaining. So there's this guy, and his name's Phineas Gage, and I believe he was like in the British Army or something like that. And he was, and Phineas Gage was not the most well liked guy. And he's loading this musket up, and the thing goes up, and it shoots the ramrod up through the bottom of his chin and out the front of his head,
Wow.
severing his
Frontal lobe.
yes, frontal lobe. What they observed from him, because he lived amazingly,
Um,
what they observed from him, he was a completely different dude.
yeah. Nice.
Yeah, he was. Yeah, all of a sudden, people started liking him. But what they took from that is, and anybody that's got any personality defects, if we just cut that part of the brain off, they're more agreeable. Well, they're robots, but
Right.
yeah. So that's the history of that whole thing, which I think is just pretty fascinating. But so we look at with your brain function, with faith or with hope. Um, we saw that injury and we were able to put forth a protocol to help with that. So I brought one of the things that we used with her. It's called microrev neural, And so this is a company, Third Planet. All Third Planet does is mushrooms. Okay. So I got 4 different ones here. I'll talk about them briefly, but this one particularly with Hope has got lion's mane. Pretty much everyone's heard of lion's mane. But what they've done here is they figured out how to compound it and then how to couple it with something that delivers it better. So I took a master mycology course a while back because I wanted to understand how these work. And this is what happened in Hope's. Because we saw this injury, we know that the neurons within her brain were damaged to some degree. And we understand what concussions are, the injury to your brain.
Sure.
Bruise, contusion, whatever. Yeah. So because we understand that lion's mane can actually nurture, rebuild, and heal neurons within your brain, they're specific to neurology, and specifically something in them called ergothioneine is an active ingredient that has been shown clinically to work better than just about anything else out there.
Sure.
Couple of obstacles that you run into that mushrooms can overcome. We have this thing called the blood-brain barrier. And one of the biggest things that we run into is an inflamed brain, like we were dealing with Hope, which history with her was super, super cued in, smart, athletic, just the girl was tuned. And like one of the most well-spoken people I've ever seen for her age. When she came into my office that day, you could see a deficit. She was confused. She was the way that anybody would be after a concussion. So we did use the turmeric. We use this, and what we know is that ergothioneine can cross the blood-brain barrier and help drive down that neural inflammation, which is thought to be one of the main causes of CTE, the football binge, which, it's not just football, but that's when they start paying attention to it.
Well, football definitely almost is a direct correlation to
it. It is, but a lot of different things. Believe it or not, there's some research out there that shows that there's more concussions in soccer than there is football. Go figure. So, but having said that, the CTE, that combined traumatic encephalopathy, the criteria for that is numerous concussions over time.
Inflammation.
Yeah, exactly.
Swelling.
Important thing to understand with concussions too is only about 30% of concussions actually result in a loss of consciousness.
It's not
90% you don't even know you have.
Yeah.
So when we apply these things and we can cross that blood-brain barrier and we can help drive down that neural inflammation and heal the brain, along with using what's called a drainage tonifier, helps to open up your lymphatics to get it out. Then you get into a situation where you can truly heal a brain. Now, this may sound outrageous for me to say this, but I can prove it. And we did with her, and I have hundreds of times over. So we ran this protocol, and the current concussion protocol right now is not much more than it was when we were in school. What's your name? Where are you? Things of that nature.
2 weeks off of activity.
Exactly. If you can do your homework and go back to play.
Sure.
Nobody is checking to see the condition of these people's brains. And we have the technology to do it, but they're not doing it. So now we're at a turning point because probably everybody that's listening to this knows in the last few years, young athletes have been dropping down the field.
Yeah, that's not good.
No, it's not at all. And so a lot of the history of a lot of them is multiple concussions. So when we look at that, and there's not a real good way within the medical world to fix it, then we start looking at, well, let's make a better helmet. Let's do this, which has its value, but that's not getting to the core problem.
Right.
So one of the problems that we deal with pharmaceuticals with your brain is the ones that can cross the blood-brain barrier. They were actually originally based on how we know cocaine works in your system. Problem is that they're inflammatory because they're chemicals, and we don't have chemical receptors to use those to improve our physiology. And so food does that for us. So it turns out mushrooms are probably better. They're probably the most valuable food a human being could eat. Historically, we know thousands of years ago, they found an ancient civilization in Italy. Well, they didn't find that thousands of years ago. They found about this civilization.
Probably.
Yeah. And as they were examining them, they found spores in their dental calculi.
Oh, interesting.
So they were eating mushrooms. The great apes eat mushrooms. So we're beginning to realize it's something that we should be eating, but people don't eat enough of them. So now they're encapsulated, and they've got this technology where they're compounded and things of that nature. So Third Planet's on the cutting edge of it. And as we learn more and more about mushrooms, we are able to use them better and figure out how to deliver them. So in Hope's case, we did her post scan, and I wish I will have to pull that up. Maybe we'll put it up one of these days. But anybody that looks at this report can say not good, good.
Right.
And so,
Yes.
yeah, so now we're looking at, well, we have a viable way to be able to say, here's Dr. Mike. I get a baseline on you because you're part of a football program. Brain's functioning well because we have data to show what somebody your age, how well their brain should function.
No.
So then you bump your head, you come in, I scan you. Now we have a comparative difference. We apply a protocol to you, rescan you, and now what we can do is say, you know what? Dr. Wegman is 90% of what he was pre-concussion. We can say beyond any doubt he is healed from this and he's ready to go back to sports. And they're not doing that.
Yeah, no, that's got to improve for sure.
Yeah, I'm working on getting that going, but boy, and this probably doesn't surprise you, lots of red tape. Lots
Oh
of
yeah, because you're trying to get into the schools,
Yeah.
and you're getting into the government, because they regulate the school system.
Mhm.
Yeah, there's a lot going on there.
Yeah.
But a parent could opt to be a little bit wiser and choose to do that outside of the school system.
Yeah, yeah.
They come in, get a brain scan, and say, "Hey, my kid's going to play sports."
Absolutely.
There's
Absolutely. And they're very affordable. A couple $100, I think, to know how well your brain's functioning.
yeah, it's pretty
I think that's well worth it. And just I guess to wrap this up, I know we talked about stress a little bit. There's a whole line of adaptogenic mushrooms and the microrev adapt. We got the microrev immune, so immunity is a huge thing. There's mushrooms that significantly help to upregulate immune function. And then, well, you'll know why in a second. The microrev derma skin. This is the tremella mushroom. The tremella mushroom, for thousands and thousands of years in ancient Chinese herbal medicine, has been known as the mushroom of beauty. So, uh, skin is lining your intestinal tract. It's very good for digestive functioning. Works real good with the glutamine. But also, who doesn't want to have radiant skin? Who doesn't want to have a little bit of built-in protection from the sun?
Right.
So that's one that people really like. There's actually a really funny story behind this too. The long ago, there was a Chinese emperor that had multiple wives, and one of his wives was considered to be the most beautiful woman in the entire world, and she was known to regularly consume this tremella mushroom. Well, it got to a point where I guess you call him the nobleman or whatever, his court decided that he wasn't doing his job because he was paying too much attention to this beautiful wife of his, and they had had enough of it, so they killed her.
Whoa.
Yeah, so problem solved. But so that's I guess that's how powerful that tremella mushroom is.
Yeah.
But these are hard to keep in stock because you know what? They work. All I have to do is recommend them. They do the job. So
And that's nice when supplements do what they're supposed to do.
well, yeah, absolutely. And like I said, good ones that are used properly change people's lives. They get mine. So, and we're in the golden age of that. There's a lot of research. I've been involved in formulating some of the newer formulas. Some of the latest things that have come out. There's a lot of hormonal balancing things. Shilajit is an amazing. It's a mossy like anything that comes out of the Himalayas. We've known about it for a long time, but now we have the studies to know what's an appropriate dose for a human being, what's the max dose a human being can use, things of that nature. So now we're starting to understand and be able to use those. And it is the exact same technology that's used to make pharmaceuticals. And that technology, which is amazing, has trickled over. And now we're just using things that our bodies have built in receptors for. So going back to that ergothanium thing, as far as we know, human beings are the only species on the face of this earth that have dedicated receptors for ergothanium.
Yeah, that's interesting.
I think we need it.
Yep. Yeah, I've done an email on the differences between the great ape and humans because a lot of people think they're very similar, and the differences are very vast. Even though we share like I don't know 98.2% of the DNA, the differences are wild.
So speaking of that, and to your point, we actually share 30% of our DNA with mushrooms.
Oh, that's interesting.
Yeah, the interesting thing is what part we do is the cell wall structure.
The cell wall structure of our cells shares a DNA
with mushrooms.
Wow.
Yeah, isn't that amazing?
That is interesting.
So once again, is there a synergy there? Do we need it? I said yes.
Well, definitely the body would respond to it better.
Yeah, absolutely. So, being as 100% non-religious, it's just that nature gives us what we need to live. And we need to be understanding how to use it properly,
Sure.
and more than anything, avoiding the things that we shouldn't be using.
So if somebody wants to find you, what's the best way or the easiest way?
Oh, there's a few different ways. If you're into the social media thing, Discover Health Chiropractic Center is my chiropractic business, and we do a lot of our functional medicine stuff through there as well. That's on Facebook and Instagram. Our website, Discover Health TC for Traverse City, so discoverhealthtc.com. Obviously, my name's Dr. Brandon White. You can find me on the web and things of that nature. We'll be definitely doing more of these podcasts. I do videos on different supplements that I use and just different topics that come to me.
Does that website have a store on it?
Yeah, so that's how we do fulfill a lot of orders through our web store, and there's a link right on our website to get to it. We have a pretty unique thing because it's so very important to me for people to get the right supplements. So I've got a brief form that
I
people
was
can
gonna say,
fill
I should
out.
probably talk to you first or
Yeah,
something.
yeah, just do a brief consult from it. It's not expensive. Everybody's told me it's well worth the time. In fact, most of the time I can't believe you don't charge more for that. But the reality is you can get the years that I have in studying this in a consolidated amount of time, and I can help kind of point you to some better things.
Sure.
And then, in reality, I end up seeing a lot of people in my office. I do telehealth. It's here to stay. I struggle with it a little bit, but
It's interesting.
it is. But it's here to stay. People are accepting it, and it's an outlet to be able to get to more people. So, and occasionally I'll do some speaking in the community and stuff. It's just gotten so busy, in my life with my wonderful family.
Sure.
I like to
Which,
spend much time.
which statistically you weren't supposed to have after the blood transfusion.
Yeah, that's actually the bone marrow transplant. Yeah, so it is a blood transfusion. So one of the things that they did tell me early on before the bone marrow transplant was you need to bank your sperm because you're not going to be able to have kids afterwards. And which, by the way, all the absolutes that they speak in just drives me nuts. I never do that because we don't know. So,
Right.
but so having said that, the I lost my train of thought there.
The 3 kids.
Oh yeah. So I was told that I'd never be able to have kids, and I was supposed to bank my sperm, and I didn't do it because, of course, everyone else from earlier in my line of thinking, well, you're wrong. I will have kids. I sit here before you, a man with a vasectomy, because it got to where if I looked at my wife, she would have a kid.
All right.
So I'm so blessed to have three of the most beautiful girls in the world as my daughters, and it's such an incredible honor to be their dad.
So it is fun, man.
Oh man, I know. I watched you do it before me, and
We're a little bit ahead of you, but it is good.
I'll tell you, my friend, if my kids turn out anything like yours, I will be fulfilled.
So thank you.
You've done a great job.
That's called love.
It is. It says love and sacrifice.
Yeah, love, sacrifice, putting a lot of effort and time into them.
Yeah.
Yeah, it's definitely good stuff. Okay. And if you're new to this podcast, you can find me at purposemaker.com. I've been writing newsletters for about 2 years weekly. That's my main way of communicating with my patients. And then if you're looking, I do teach some classes. As we were talking about that diabetes, I now have a diabetic mastery class. I got a longevity class and a weight loss. I'm gonna probably launch a second weight loss class here for the New Year's, but that's purposemaker.com/wisdom hub, because part of midlife is about learning. So I got this idea for this podcast was realizing that a lot of people want to learn this stuff. They want to improve their lives. So is there anything you want to add as we wrap this up here?
Yeah, I do. I'm glad that you closed with talking about your newsletter that you do. I get 600 emails a day. I never miss reading yours. Might be a couple of days later. It's intuitive. It's full of information, and it speaks to me every time. So you've got a lot to offer your fellow man, and you are really coming into yourself with how you're delivering it. I'm amazed. I'm impressed.
Well, thank you for taking some time out of your life to come up here and do the podcast.
Anytime.
I appreciate that. So we're going to sign off. Hope you enjoyed this a little bit over an hour, and we'll see you on the next one.